Hello, ladies and gentlemen. Welcome to Triple N Media. I am NIK NIKAM from Houston, Texas. This is a COVID-19 World News Update, Wave 3, and what we need to do, what we need to know. So let us begin. COVID-19 Pandemic 2021, Wave 3. All across the globe, more than 127.8 million people have acquired COVID-19 infection, of which 2.8 million people have died. In the United States, we had the wave 1 at the beginning of March and April in 2020. Then we had a little blimp during the summer with the relaxation of the COVID-19 lockdown restrictions. Then there was a mega wave 2, which we just went through between November and January, and now we are beginning to see an uptick in the number of cases here in the United States, along with the number of admissions to the hospitals. And this is a chart showing all across the globe. Second wave, which peaked during the first week of January, was followed by a steep decline. But by the same token, there has been a significant uptick in the number of new cases all across the world, now standing more than 600,000 new cases per day. We are beginning to see a sudden rise in the number of new cases in several parts of the world. For example, Brazil has a number of new cases topping close to 100,000 per day. And this is the third wave in Brazil, which is having the worst outbreak of COVID-19 infection. Similarly, we have Poland, which is showing a wave 3, with more than 30,000 new cases, which far exceeds the number of cases seen during the second wave in Poland. And so also in India, we have a steep increase in the number of cases, coming close to a tune of 70,000 new cases per day after the numbers had dropped to below like 10,000 cases per day. Despite the fact that many of these countries are aggressively pursuing the vaccination program, still we are seeing this uprise of wave 3 from various parts of the world. And here is from Germany. There are several places in Europe like Germany, Poland, Belgium, which have experienced a sudden surge in the number of new cases. As you can see in Germany, they are reaching beyond 20,000 new cases after it had dropped to less than 5,000 new cases. Germany has one of the best healthcare systems in the world, and yet, Germany is not able to contain this virus. The virus is just running its natural course of 3 waves, as we saw a similar pattern in the Spanish flu in 1918 and 1919. Story here in Philippines, where the number of new cases are close to 10,000, far exceeding the number seen around 6,000 during the second wave in Philippines. So the increasing number of cases is all across the board: Asia, Europe, Middle East, United States, South America, Africa. Everywhere we are seeing a surge of these new cases coming to light for the third time in this pandemic. Let's talk about vaccination. Of course, vaccination is going on very briskly in certain parts of the world. Israel leads in the number of people who have been vaccinated. More than 50% of their population has received at least one dose of the COVID vaccination. And as you can see, more than 500 million people all across the globe have received the vaccination. And United States, we have 143 million people who have received at least one dose of COVID vaccine. Similarly, India has like 60 million people in a country with a population of 1.3 billion people. United Kingdom, half of their population is approaching at least one dose of COVID vaccination. But looking at this, the number of vaccinations that have been administered so far is minuscule compared to the world population of 7.7 billion people. We have not even touched the surface of the population in terms of reaching herd immunity. Only perhaps in the United States, we have maybe 12% of the population that has received both the doses of a COVID vaccine. Germany, as I said, which has one of the best healthcare systems, expects more than a year to make sure that their entire population gets vaccinated. Germany, with a population of 83 million, has had only 12.87 million doses of vaccine delivered. That's approximately like 6 million people. So it's going to be better part of this year before the entire population in the world, or majority of the people, would have had a chance to receive the vaccination. In the United States, as we can see, we are 143 million, but with a population of 330 million people, you're talking about at least 660 million doses. So we are just about maybe 25% of the doses that have been administered at this time, and we still have a long way to go. What does that mean? That means more than 2/3 or 70% or 80% of the population has not had the vaccination. So they are as vulnerable as the first group of people who were exposed to the coronavirus. If they are exposed to the coronavirus, they have a pretty high chance of getting the coronavirus infection. Of course, let's talk about the vaccines and how effective these vaccines are and how they prevent serious COVID infections. Pfizer, BioNTech, and Moderna enjoy better than 94-95% protection against the COVID vaccine. They also have majority of them have decreased the incidence of severe infections and hospitalizations. Johnson & Johnson, which was found to be 72% effective, was also tried in South Africa and Brazil. So it has a better chance of addressing these variants from Brazil and South Africa. Same story with AstraZeneca, 62 to 90% effectiveness depending upon which part of the country results we are looking at. Sputnik, the Russian vaccine, was found to be 91%. No doubt these vaccines of COVID-19 are pretty effective in reducing the incidence of a COVID infection. More importantly, these vaccines are very effective in preventing hospitalizations and severe symptomatic COVID-19. Let me repeat this statement. This statement sort of underscores the importance of getting even at least one dose of a COVID-19 vaccine. With even one dose of COVID-19 vaccine, the protection is around anywhere from 50 to 70-80%. So even if people had one dose of vaccine, which is one of the reasons why British decided to go with the first dose in more people's body versus just giving two doses to a small percentage of the population, and it seems to have worked in Britain's favor. That's something the rest of the world can really pay attention to. The vaccines do work. They are effective in preventing the COVID-19 infection. And more importantly, vaccines are effective in reducing severe symptomatic COVID infections and reducing hospitalizations. The mortality in the vaccine-treated group is almost near zero from COVID-related infection. And that is the main purpose of the vaccine. The main purpose of the vaccine is not to eradicate the entire disease. Our flu vaccine is only 50 to 60% effective, and still 160 million people receive flu vaccine here in the United States each year. The purpose of the vaccine is to reduce severe symptomatic cases and hospitalizations and complications so that people can live with minor symptoms. People can live with a positive COVID test as long as they are not symptomatic, as long as they are not sick, and as long as they are not spreading the infection. And that's the bottom line. In that purpose, all these vaccines from Pfizer, BioNTech, Moderna, it should be BioNTech, Moderna, J&J, AstraZeneca, Sputnik, they all achieve that purpose of reducing the incidence of severe infections, hospitalizations, and mortality. That is the key for vaccinating as many people as we can all across the globe in the shortest time period we possibly can. Now let's talk about new coronavirus strains that are circulating all across the globe, for that matter. We have the UK one, which has been known for several months since the beginning of January, the B1.1.7. Then we have the South African variant, which is B.1.351, which is supposed to cause more serious symptoms, but we also found these are affected by Johnson & Johnson vaccine. The Brazil variant, which is P1, seems to be most widely spreading, as we can see in Brazil, where the number of cases are skyrocketing day by day. It is not clear whether the existing vaccines will protect against all these variants as good as they do with the original variant of COVID-19 virus. What do these new variants mean? They spread more easily from people to people. Some of them have lesser incubation period. That means patients can develop symptoms within a few days versus 1 to 2 weeks. So they are more likely to spread the infection long before they even get sick. They are currently detected by the viral tests that we have, the PCR tests. They are supposed to respond to the monoclonal antibodies that we have against the regular coronavirus strain spike proteins. The effectiveness of the vaccines in preventing these variant infections still needs to be tested in real time. What actually triggered Wave 3? There are multiple reasons why we are experiencing Wave 3. It is a natural process of evolution, as we saw in the 1918 Spanish flu. It had 3 waves. The first one, the second one was like 5 times bigger than the second one, then the third one, which was bigger than the first one. And that's how the 3 waves came across. And there are several factors that sort of culminate into Wave 3. The new strains of viruses, which may not be prevented by existing treatment modalities and vaccines, people's disregard for self-mitigation, certain population frankly refusing the vaccination even if it's available to them, and less than 10% of the world population has received the vaccination at this time. Still 90% of the population is still vulnerable to get COVID infection if they are exposed to a person with COVID infection. And they tested in Barcelona. They had a concert with 5,000 people to see how effectively they can control the infection. I don't think we need to wait for the results, do we? We have seen what happened during the summer months when the lockdowns were lifted, when people rushed to the beaches, bars, and nightclubs. There was a sudden upsurge in the population between 20 to 40, the younger population, getting these COVID infections, getting more admissions to the hospital, and some of them getting really sick with lung complications. So we don't think we need to wait for the results. When 5,000 people get together, if they had not had the vaccination, their chances of getting COVID infection are pretty high, as they would have been if they were during the first wave. So what do we need to do? Common sense. We need to vaccinate more and more people. We need to increase the number of people who are vaccinated, so there's less number of people spreading the infection, which results in less infections and less hospitalizations and complications. So for the foreseeable future, I would say for better part of this year, we need to continue to use masks to prevent the spread of COVID-19 infection. Social distancing and avoiding large gatherings. All these things go without saying, especially if you had not had the vaccination. Even if you had the vaccination, I would still take these precautions, because we have no idea whether the vaccinations would protect us against these virulent forms of COVID variants. And also, we have no idea as how long the vaccination effect is going to last. Moderna tested and came up with the speculation their vaccine may be effective for a year. That time is going to come pretty soon. That means we may be in for an yearly vaccination against COVID-19 until we can dramatically vaccinate a large population size and thus prevent this pandemic from getting worse than what it is today. Ladies and gentlemen, you have been watching Triple N Media. I am NIK NIKAM, and this has been the COVID-19 pandemic world news update, Wave 3, and what we need to do. Thank you so much, and please do subscribe to our channel. We will see you next time.